Vital signs. These are the measurements of the body's most basic functions. The mainly signs are temperature, pulse rate, respiration or breathing, and blood pressure. In this video, we will teach you how to take vital signs in an adult. The normal parameters we will be using are only for adults. We always have to tell them the procedure. First, we have to prepare the area we will use in all the equipment. We will use such as a thermometer, a blood pressure cuff, a stethoscope, and we will also need a watch to take the pulse. Temperature. This is to measure your body's ability to make and get rid of heat. The normal rate is 36.5 degrees Celsius. We have to lower the mercury by taking the thermometer from its distal part until it's lower than 35. Ask the patient to lift her arm and put the thermometer in the middle part of her armpit. Leave it there for 3 or 5 minutes. Once this is done, ask the patient to lift her arm and put the thermometer in the middle part of her armpit. Leave it there for 3 or 5 minutes. Respiration, the act of inhalation and exhalation. The rate of this is 16 to 20 respirations per minute. We tell the patient that we will put her arm on her chest. Put your hand on her wrist. This way you will feel how many times she breathes. If you have the ability, you can check the pulse in that position for a minute. The normal pulse is 60 to 80 beats in 60 seconds. We can take it in the wrist, inside of the elbow, on the side of the neck, and on top of the foot. Blood pressure. It's the pressure of the blood against the inner walls of the blood vessels. The normal rate is 120/80. We tell the patient the procedure. We ask her to hand us her left arm for preference, because it's closer to the heart. We put the arm on a solid base. Then, we put on the arm the sphygmomanometer bracelet, leaving a space of 2.5 centimeters above the arm articulation. When we locate the brachial pulse, we place the stethoscope over the brachial artery and hold it with your index and middle finger. Then we close the valve to the right, and we insuff the valve to 160, depending on the patient's condition. Then slowly deflate the valve and observe the manometer until you hear the first beat, called systolic, and the second beat will be the diastolic. For last, we write down the ups, putting first the systolic rate and then the diastolic one.